back. If you are late joining, it's totally okay. You always can catch the replay game. Before we get started, go ahead and press that thumbs up for your cousin. If you are new here, thank you for joining, as well as go ahead and subscribe and turn that notification bell on so you will be notified as soon as I start a live, okay, or drop a video. On today's video, we're going to go ahead and do a review on Dr. Jeff. He's over here at Smart Plastic Surgery, okay? I have yet to look at any of his live videos, so we're going to do a live reaction video on him, and immediately in between we have to stop, as well as discuss, or just talk in between, because YouTube policies or whatever. If y'all have any additional questions, feel free to ask. I will pause the video so we can go ahead and interact with each other. But like I said, let's go ahead and jump into this video over here with Dr. Jeff. Hey cousin, hey Sean, hey Kanisha, y'all come on in. What really stood out to me is what he said in regards to the tummy tuck. I'm not gonna lie, it's very hard find a doctor that's very clean cut with his tummy tucks, as well as very precise. With Dr. Jeff, like, I'm feeling some type of way. Like, I like my tummy tuck. Don't get me wrong. Dr. Simmons did a good job. I didn't get any infections. I didn't have any issues. But I don't know. Like, I feel like Dr. Jeff should have been my surgery soulmate. Like, I really like his procedures. Like, he does amazing work. He does, and I love his breasts. I freaking love his breast incisions as well, because he doesn't go from side to side. He do like a middle cut, which is real clean and sleek. Don't get me wrong, I feel like Dr. Triggs did an amazing job. But you know how if you see somebody else's breasts and they look even better than yours, you like, oh, I wish I would have went to him. But I mean, even still, I'm gonna end up I'm gonna end up getting a tattoo cover up. But everybody don't go that route. So I know for sure when I make 10 years, Dr. Triggs told me in 10 years, the coordinator told me in 10 years that I will have to get a follow-up and a touch-up after 10 years or something like that. Once I go back and get them done in 10 years, I'm going to the grave with those, because I'll be in my late 40s. But anyways, enough of that. Back to Dr. Jeff. Hey, Gloria. Yes, Gloria, girl. Yes, yes. I have not seen one job that I do not like. I have not seen one job that I don't like. I have not heard any bad reviews. Actually, on this lady here, on her breast, like, y'all know that he's a reconstructive surgeon. Actually, on this lady's breast, I forgot what it's called, but basically in layman's term, her breasts were spaced apart. And Dr. Jeff brought her breasts together, and I think he did her augmentation. Oh my God, they look so good. And then, like, I like the fact how he specialized. See, he gets the assignment. He understands the assignment. And this is what I have to give this man his credit. Like, he understands the assignment. When it comes to these dolls coming to him, everybody body is different. Everybody have all of these unrealistic expectations. But when it comes to Dr. Jeff, I feel like when you're back there and you're telling him exactly what it is you want, he can do it. Like, some doctors can't do skinny BBLs. Some doctors can't do curvy girls BBLs. Some doctors can't do slim thick BBLs, or dramatic, or natural, or just a lift, or just to add some flats. But Dr. Jeff, I feel like, yeah, he's doing it. He's doing a very, 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 very good job. And don't get me wrong, I like Dr. Shanklin's tummy tucks as well. He does tummy tucks real good. Two of my cousins went to him for a tummy tuck. He did their tummy tuck real good for their mommy makeover. So Dr. Jeff is definitely doing the thing over there at Smart, and I gotta give it to him. I gotta give it to him. Now, y'all, I don't want y'all to get, too overwhelmed or anything with everything that's going on over there in Miami, period. Not just at Vixen, not just at Smart. It's a lot of stuff going on. But we're gonna focus on the positive. Everybody chose their doctor of choice. Everybody should have done their research. So your results will be your results, regardless of what doctor you chose, regardless of your post-operative. Remember, we definitely have to take care of ourselves after our post-op. That's what's mainly important. That's how you're going to see your results, cousin. Y'all cannot be in the mirror all the time. I had to learn that my first 2 rounds. You cannot be in the mirror all the time. Especially with the tummy tucks, you have to give yourself time for the swelling to go down, as well as for that tightness to loosen up. Let me tell you something. If you get a tummy tuck and you not tight and you not hunched over or in pain, something ain't right, cousin. I'm talking about a tummy tuck, baby. A tummy tuck, you supposed to be like, oh my God. Oh my God. Like, seriously. Like, I know everybody pain management is different, but at the same time, if you are getting a tummy tuck and he done snatched that tummy, baby, let me tell you, honey, you gonna feel it, but you gonna see those amazing results after a few weeks. You just have to be patient with yourself, don't get overwhelmed and don't try to rush your recovery. So I just wanted y'all to hear this little part that he's getting ready to say about the tummy tuck, actually, that I just reiterated on. And then we're going to jump into his first live, part 1, and then we're going to jump into the part 2 of his live that he did today. I didn't even know he did a live today. I'm going to have to turn his notifications on. So also, if y'all watching this video, turn my notifications on. If you follow a particular doctor or your doctor of your choice, be sure to turn their notifications on so y'all can be notified when they go live. And when they go live, they interact with the Q&As, and you can ask as many questions as possible. And hopefully, they'll answer some of your questions, and you'll be better relieved with some things that's going on. So yeah, let's see.
Most people following a tummy tuck procedure do feel the need to walk a little bit bent over, and that's because they feel the tightness from the abdominal incision. If you don't feel any tightness, the question is, how tight is that repair of the muscle and of the abdominal flap? But in most cases, patients will feel a little bit tight there and will want to walk a little bit bent over, and that will improve over the next couple of weeks following surgery.
That's right. That's right. He hit it on the nail. It will improve over the next couple of weeks of surgery. So let's go over here to Smart. Let's go over here to Smart. So we can go ahead and find, let's see. Where is that first video? Let's go over here so we can get into this video with our boy. I hope they ain't playing no music, because they ain't supposed to give me copyright.
And here in our Smart studio, and we're answering questions for you live.
Hi, beautiful dolls. How we doing?
Ooh.
So,
hey, boy.
Many of you know me already from Instagram.
Lazaro's famous.
So today we're going to be with Dr. Jeff, answering some questions. We're going to be also answering live questions while we're here with you guys. So feel free to ask all the questions you want.
I wish we could see the questions.
So do we start, Anderson, with the questions? Okay, so the first question we have is from Fit Main Babe. How long do you have to stay in Miami, doctor, after a mommy makeover if you're coming from out of state?
It's a great question. We see patients all the time from out of state. Typically, after a mommy makeover, which is either a tummy tuck and liposuction with either a breast lift or BBL, the combination procedures, we really prefer people to stay 7 to 10 days. We see you several times during that time frame, and at that point, we know that you're doing well. You're already off and running during your recovery period, and at that point, it's really safe to fly to another part of the country where you're from.
So the next question is from Positive Strong Believer Me. How many days do I have to wait to drive after Tummy Tuck and Lipo 360?
It's a great question from Strong Believer. It's a great name, right? That's what we want around here, strong believers. That's what it's all about. So another good question related to the first. Okay, so for starters, okay, as long as you're taking pain medication, you can't drive. Okay, so once you've stopped taking all the pain medication, probably 5 to 7 days later, you can consider driving if you're comfortable in that position and feel that you would be safe while driving. So I'd say probably 5 to 7 days, but it varies. Might be a few
Wait a minute.
Okay, so
I pause this. Okay, let me let y'all know right now. This is my first time looking at this video, so I did not want to look at it before I recorded it and went live with y'all so I can give my real honest live reaction. Let me tell you something. I don't know what it is about this man, but like I love his energy. I love that he's direct with his answers. He's very informative. You can tell that this is definitely a passion for him. Um, and not to say that it's not for the other doctors, but right now this video is on him. So we're gonna focus on Dr. Jeff. I want to say that from my standpoint, from just looking at his, I don't know, his personality seemed like, yeah, he's really this is what he's about. He's not just about the money. Even just looking at what he's charging, what him and Shanklin charging over there, and that's his own practice. So you would think that they'll be charging even more just to maintain the office space, the building, and everything. So you can definitely see that this is not like a money gimmick for him and Dr. Shanklin over there, that they are really like, this is a passion for them. Now back to Dr. Jeff. I'm ready to actually see like how far he's gonna go. I haven't really seen any major combos yet, but like I feel like they are coming. If you have seen any combos, he's done like a full combo, like Lipo, BBL, 360, Tummytuck, breast aug. Send it to me. I'm really interested in how far he can go. I feel like he's going to drive a lot of traffic over there to Smart, being that it's just him and Shanklin over there, and all the stuff that's going on over there at Vixen. I hear a lot of girls are leaving and coming over there with Shanklin them. So I am really wondering how far he's going to go. Not only that, I see he does like facial reconstruction. He was doing some lady eyelids. I said, oh my God. Yes, I'm going to do the live they did today, Sean. But like I say, when I do the live reaction, I can't see the questions. So I'm not going to be able to see if y'all ask them questions, but I can hear them answer the questions. But they may call out y'all name like they're doing on this live too. So we'll see.
Believe me, strong believe me has another question. Okay. How long can the drains come out after Tummytuck and Lipo?
So that's a very common question. Typically, we leave the drains in place for 2 full weeks, 14 days. Okay, and they serve 2 purposes. Okay, the first purpose is to remove any fluid that would accumulate normally, so we don't have a collection afterwards. Okay. And we really like to leave those in for 2 weeks to address that. And the second reason is that the suction from the drain helps keep that abdominal flap really in place and start the healing process. So we leave them for a full 14 days. And those can be removed here in Miami or anywhere else in the country.
Yep.
So they could be taken out of whatever.
Exactly. So you can leave with the drains in place. And there are some patients we have who actually ask us to train them so they can remove them themselves.
Oh, wow. Y'all hear that? He said that they will show you how to take your drains out yourself if it's time to get them taken out. Because if it's draining, if your drains are filling up to 25 cc or less, you can go ahead and get them removed if it's been at least 10 to 14 days. But if it's less than those days and you still feeling to 75 cc, you definitely don't want to get those removed, even if you do go home early within the 10 days and don't let your doctor remove them. You want to make sure that you're not removing them too early, because you definitely don't want to get an infection, and that's what we definitely don't want to do. So let me see, let me get him pulled back up.
So we have a Maui name. Can you come in to see the doctor in person?
Of course. We love to see all of our patients, so feel free to call our team, make an appointment, and we'd be delighted to see you in person.
Yes, so now we're going to go into the live and we're going to start answering the questions directly from our beautiful dolls. So dolls, start asking anything you would like to know. So we have round.
Here we go.
Minoka 2023. So, why would you want the hernia removal for optimal results?
Okay.
Mm-hmm.
So we see hernias very commonly. Typically, ventral hernias usually around the belly button. When I see this, I repair this at the same time as the tummy tuck procedure. We don't want to see a bulge afterwards. We don't want to have any, interruption of that fascia because I'm repairing the abdominal muscles, the rectus muscles, from this point at the xiphoid, all the way at the breastbone, all the way down to the pubic region. So when the muscles have come apart, like two doors that have opened after, say, pregnancies or gaining weight, we close those doors.
Okay.
That gives you the flat belly. So why repair the hernia? In the middle of that flat belly where the muscle is repaired, you don't want that hernia sticking its head out. So that's repaired at the same time.
Okay, so our next question is from Tony 67. How long can you have a tummy tuck after a BBL?
Typically we space things, depending on the recovery, by 6 weeks to 3 months. So it really depends on the person. It depends on how comfortable they are following surgery, how well they did, how easily they recovered, and then together we make a decision as to how to space things out.
Okay, perfect. So,
typically 6 to 12 weeks.
Oh, that's cool. Niadra says, do every lipo procedures require drains?
Actually, usually no lipo procedures require drains. So if it's a straight liposuction procedure, I never use drains.
Okay. Perfect.
I also never use drains for breast procedures, whether it's an augmentation, a lift.
Oh, yeah, because some doctors do.
I've never done that in 23 years, and I've never had the need to.
Okay.
Period.
So Lidilia20 says, I am in Canada. I want to go. So how many days I have to stay in total? When can I fly back?
After which procedure?
She didn't specify the procedure.
Okay, fair enough. So it varies based on the procedure. Okay, so the same answer would apply to someone going to a different part of our country or to Canada as far as a tummy tuck and a BBL, a larger combination procedure. Typically, 7 to 10 days. But if it's a breast augmentation or if it's a straight liposuction procedure or perhaps a facial procedure, typically 3 to 5 days would be sufficient for a less.
Y'all, I want to know what he doing to the face. Is he doing, what is he doing to these people's face? Are he doing nose construction? Is he reconstruction? Is he doing lips, fillers? I see he doing eyelids. Oh, I got to look him up.
Intense procedure.
Okay, we have Nicole Fournier. Is J plasma recommended for someone who has lost weight and is looking for a lipo 360?
So J plasma is a great technique. I use it fairly commonly, and what it is radio frequency energy, not laser. That doesn't create a lot of scarring, but radio frequency energy instead, which causes skin tightening without all the scarring that we see with lasers. So this is used for people who need liposuction, but also have a little bit of skin looseness, a little bit of laxity. Okay, if somebody has lost a lot of weight, there's a really good chance that this amount of tightening is not going to be as effective as, say, a full tummy tuck procedure, really a more extensive procedure. And we do this in conjunction with tummy tuck sometimes. Depends on whether it's a skin-only procedure largely, or a procedure in which, the real situation is just a little bit of skin laxity. But if there's significant skin laxity, we're not going to do it because we're not going to do anything that's not really necessary and you're not going to benefit from, right? We're not selling used cars here. We're doing what's really going to benefit our patients.
Exactly.
There are many areas of the body where we would do J plasma, including the face and neck, including the back, including the sides, including the arms, including the inner thighs. So it really depends on, being evaluated critically to determine where we're going to get the most benefit from this technique. But it really is helpful in the right patient.
So our next question is from Blossom Barney Boutique. Do you lipo the top part of the stomach when getting a tummy tuck?
That's a great question. Okay, that's a great question because a lot of people don't. Okay? And there's a good reason and a rationalization for that. It's all about blood supply. Okay, so when we make an incision down below, this entire flap is elevated. That potentially compromises the blood supply. Certainly, we're not getting any blood flow where you made that incision. So people are often concerned by compromising the upper flap, which is now going to be living down below. So if you compromise the blood supply to that flap, you could get a separation or tissue loss inferiorly at the midpoint of the incision. Okay, so that's one concern. However, for the past 23 years, in almost every tummy tuck, I've routinely done liposuction for the upper abdomen. In fact, every tummy tuck for me, in almost every case, let's say 99% of cases, would include liposuction of the upper abdomen as well as the flanks. And if you're pretty careful and meticulous about what you're doing in the upper abdomen, you should never have a compromise of the blood supply. So in my hands, I find it to be a very safe procedure. So in answer to your question, the short answer is yes. All right, so we do it.
But my thing is, if he's on the abdominal area, of course, the tummy tuck, and then he's doing the two flanks on the side, what about those love handles and that back fat? So I guess if you getting a tummy tuck by itself, just a tummy tuck, I mean, I would add on Lipo 360. Might as well Lipo the back fat and broad fat as well, because from what he's saying, that's not even included.
The tummy tuck procedure.
Okay, so next one is Diva Paola. Diva Paola is asking, BBL with Lipo 360. Should I do a combo with breast lift with augmentation implants?
Well, if you need it, then potentially you can. Your real question is, can you combine a BBL with a 360, which we do all the time, because that's where we get the fatty tissue to do a nice BBL. And we do 3 types of BBLs here. But can you combine that with a breast procedure? The answer is yes. We do that pretty commonly as well. So you could do a lift procedure with or without implants, depending on what your need is.
Depending on the patient and...
Exactly. Lots are depending on the patient's needs.
Okay, so Smashmere Romoko says, after you get a tummy tuck, can you get a breast augmentation within 2 months?
Yes, you can. Okay, so as I mentioned before, typically we stage
it's
the second
upper body.
procedure to 6 weeks to 12 weeks, right? 6 weeks to 3 months.
Okay.
So you're asking, could you do that 2 months later? You absolutely could. So that's a very common time frame.
Okay, so K.Banks.1 says, if I gain weight after a BBL, now my booty is too big. Can I have a procedure to reduce the size?
Oh my God.
Sure you can. Okay, so we can do the opposite.
Girl, give me that booty.
Which would be using liposuction. Okay, so anytime we apply fat to the buttock region or any part of the body, approximately 1/3 of that fat is absorbed by the body.
Okay.
Okay, so it's never exactly what you have when you leave the operating room, no matter where you place the fat. And that's fine. But again, that fat now reacts normally like any fat anywhere else in the body. You've simply taken it from here and put it there. So if you gain weight, this fat is going to increase in size also. One key point to mention is that fat has a very interesting and unique physiology. Okay, so at this point in life, we're actually not making new fat cells. Or it doesn't happen like skin cells, and doesn't happen. But instead, the fat cells you have, they either get larger or smaller based on gaining or losing weight. So in answer to your question, if you were to gain weight and have a larger, buttock region, your BBL is now, larger than you would like. The answer to your question is, of course, we could take care of that. We could recontour it with liposuction. Very easy to do.
Okay, so we have Maisha_official. How many back massages do you recommend after full back lipo?
After full lipo, right. So here at Smart Plastic Surgery, we often start massages the day after surgery, okay? Not for tummy tuck. We mentioned this last week. We don't want to go anywhere near the flap for 6 to 8 weeks. But as far as the other parts of the body, the back and so forth, we start as early as the day after surgery, after liposuction, and then we continue that. So for that, there's no such thing really as too many massages, because these improve the swelling. And that's really the main goal, to reduce the swelling and get to that final result. So back massages are fine. You can do several per week if you like to.
Okay, so Nikki Vincent says, does BBL help with cellulite?
So
appearance, or it stays the same, or it makes it look worse?
It's a great question. That's actually a very good question. So the answer is BBL typically does not help cellulite significantly. Okay, there are theories regarding the origins of cellulite and the anatomy of it, but in my eyes, there are kind of like soft tissue fibrous connections. You can imagine like a puppet on strings, where you're kind of pulling the skin down, causing these depressions or these dimples. Okay, so we may be able to break up some of that, so there may be some improvement, but in general, BBL procedure does not typically improve that, although in some cases with larger depressions, we'll add fat specifically to these depressed areas to improve that. Does it make it worse? I've never seen it make it worse. So that's good news.
All I know is who trying to who trying to get their fat taken out their booty. I'm trying to figure who going back to get that fat taken out their ass. No, ma'am. No, ma'am. Let me tell y'all something. I be so hungry, right? Y'all, I be so hungry. Like, still to this day. Like, if it's been a year or 2 years, you're still feeding your fat because, like he said, when they transfer that fat from your stomach, it's going to your butt. So that fat back there has to eat. And when I tell y'all, like, don't be like, well, I'm a year post-op. I love carbs, okay? I love carbs more than starches, okay? And when I tell you them carbs is what put weight on me, but it doesn't go to my stomach. I think it goes to my butt. It does not go to my stomach. Now that I'm right at 4 months post-op, I feel like I don't know. I feel a big relief. I can tell I feel a big relief from this last round. My back sometimes still be aching. And I still like now I do self massages and I use my roller and I weight train now. I weight train in my faja as well. I put my faja on and I put my waist trainer on top of my faja for extra compression. But now since I'm like almost 4 months, I do my 8 hours, my 8 to 12 hours, either I sleep in my faja or I work in my faja. I don't wear 24 hours no more. I do half a day now, and when I take my faja off at night, I sleep in like my sweatband or my waist trainer. I still keep something on my skin, on my body, because I don't know, I just feel weird just nothing on. Even when I go on vacations and stuff, I still immediately get right back in my faja until I make a year. Now, after my year, I'm not gonna be wearing my faja anymore. I'm gonna be strictly on my waist trainers. But as far as right now, I'm doing all three: my faja, my waist trainer, and my sweatband. Let's get back. What happened? Oh shit. 10. Okay.
All right, but we don't use this technique to actually improve these areas.
Okay, so we have now Stephanie Solo Benmore. How safe is for mommy makeover, including BBL, tummy tuck, and breast reduction?
So with the breast reduction, that's a larger procedure typically than, say, a breast lift or a breast augmentation.
Okay.
All right, and we may choose to stage that in two procedures, doing the tummy tuck and the BBL together and coming back afterwards, again, 6 or 8 weeks or 10 weeks later to do the breast reduction. But it depends on the patient. Okay, so really an in-person evaluation or evaluation by reviewing photos and having a conversation about this is really the best way to address this, because every patient is different. With different needs, and our goal here at Smart Plastic Surgery is really to tailor or to individualize our approach to each patient. Can it be done? It can be done. But if you're my relative, my goal is to really err on the side of safety. It's all about safety. That's our number one priority here at Smart, right? So you're always going to be safe, combining,
The procedures.
the procedures, but it depends on which procedures.
Okay.
So sometimes we're going to stage these into two different surgeries.
Okay. So we have 123K Ja. How long until I can see after a BBL?
How long until you can sit?
After a BBL.
Great question. Okay, so one thing we do is use a BBL pillow. All right, and kind of feels a little weird at first, but women get used to it very quickly afterwards. And that applies the pressure or the weight of your body to the back of your thighs, to those nice hamstring muscles, taking the pressure off the buttock region itself. And that's important because we don't want to apply pressure to these brand new cells that are looking for a new home in that area. So ideally, we want to protect that area for a solid 4 weeks. All right. So when can you actually sit on the buttock region itself? Well, I'm trying to say not before 4 weeks. Okay. You would be sitting on the BBL pillow, but not on the buttock itself, but on the back of your thighs. So we want to protect it for a solid 4 weeks.
At least 4 weeks.
At least 4 weeks.
Okay. So tele 67. How many areas is included in the Lipo 360?
Good question.
Typically, That includes the abdomen, the flank region, and then we spin you around the upper and the lower back.
He
So
say
really it's
spin.
360 because we spin
Look,
around.
spin me around, Dr. Jeff. I wish you could have spin me around my second round because Dr. Cannon did not spin me around. He gave me an ass, but he didn't. His assistants did not spin me around, Dr. Jeff. Where was you? I needed you a year ago to spin me around, Dr. Jeff. That man said we gonna spin you around.
360 degrees, and it's really the front and the back. You could add areas like thighs and arms and chin that patients often do if those areas are required, but that's what the 360.
I know that's right, Dr. Jeff.
So now we have Tati did my nails. Do you do dramatic BBL?
So we do three kinds of BBL.
He do all of them.
Okay, the first is the skinny BBL.
Period.
That's for the patient who may be very thin to begin with, not have a lot of fatty tissue to work with, or also simply just wants a very small, subtle change, perhaps addressing depressions of the hips alone or adding a little bit of fat to the buttock region.
Okay.
Then we have the natural BBL, and there we're adding really more fullness centrally and laterally to give a really nice contour to the buttock region.
What
And then
happened?
finally,
Why
we have
do
the
that?
smart BBL, okay? And that's going to be the dramatic BBL. You see many of our videos and photos and so forth. But that's going to be right. That's going to be the dramatic. So we do all three. And again,
Okay.
like I said before, we're really tailoring to each patient's desires and what their preferences are. But we
Okay.
absolutely do dramatic.
Okay,
BBL,
so
it's classic.
I don't know what happened, but we about to jump on the new up-to-date video because I want to hear what they was talking about today. Where you at? Where you at? Where is it, y'all? Where is it? Let's see. Let's see. Here we go.
Hey guys, welcome to our live back here at Smart Plastic Surgery with Dr. Jeff.
Hi, Daphne. How are you?
She got her
Good, how are
microphone.
Are you ready to get into these questions?
Absolutely ready. Always excited.
Oh, I like that outfit,
Alright,
girl.
let's get started.
Sure.
So I'm going to start with some previous questions that were sent in before the live. We have Marisol Avila asking, what's an acceptable BMI?
That's a great question. There is a range of acceptable BMIs. For me personally, based on my experience over the years, a BMI of 38 is really the limit for me here at Smart
Yes,
Plastic
girl,
Surgery.
she's so pretty.
And, there are cases where patients come in and they're a bit higher than that, so sometimes we want to lose a little bit of weight before doing surgery. So we'll coach you and counsel you regarding that. And for most patients having any type of body contouring surgery, my goal is for patients to lose like 10% of body weight over 6 months following surgery. But the short answer is 38.
Okay. Our next question, let's get right into it. This one's from I Love Me 92. She said, Dr. Jeff, how many cc's do you inject in each butt?
Oh, good question.
Also, do you give a lot of projection on the?
Oh, yes.
If someone wants dramatic hips or lats.
Oh,
Great question. So that varies based on the patient's needs, based on the areas that we need to address, right? So I do BBLs both by themselves as well as in conjunction with other procedures, combination procedures. So the reason I say that is because when we're doing this in conjunction with, say, a tummy tuck or a breast lift procedure, we really can only inject 1,000 cc's. All right, so typically that's 500 cc's to each side when done in conjunction with
'Cause-
another procedure. Beyond that,
okay, Sean. So you heard him, right? Because you talking about you wanted 1,000 cc's in each butt cheek. He don't do. I asked for 400 cc's in each butt cheek. I really want to know how many cc's that Dr. Cannon put in each butt cheek. I asked for 400, but I didn't know it was up to 500. I would have asked for 500, but I don't think I had enough fat anyway.
depending upon what the patient's preference is, if they want real projection, if they want a real dramatic look, we might inject 600, 800, 1,200.
Oh!
It just depends on what they need and what their expectations are.
So he's saying they can inject that much cc's. It depends on how dramatic you want it. So Sean, when you go up in there, girl, you better let him draw you up, baby. You better tell him Tell him you want it dramatic, baby. You want it plump and juicy, honey. Ooh, baby, I'm getting excited for y'all.
Okay, great. I like this question here. Dr. Jeff, do you do facelifts? And that's from Tammy Jacobs Hills.
I absolutely do facelifts. I'm trained as a craniofacial surgeon as well. So I work on both ends, so to speak. And
This man making
I
money.
enjoy doing facelifts. I've done many facelifts over the last 23 years of practice, and I'd be happy to evaluate anyone for a free consultation here.
Do you do noses?
To talk about whether or not they need a facelift and would benefit from it.
Okay, I love 92.
Let me find out
says
he
she
do
wants
the nose.
The max injected.
The max. Okay, we can do the max for sure.
For sure. Okay. Let's get into some questions here on the live. Someone asked, why isn't lipo included with BBLs? Why isn't arm lipo included in BBLs?
Because that's a different procedure.
And it should be standard in Miami.
Huh?
Okay. That's an interesting question. It's really more of kind of a business question. All right, so typically with the BBL procedure, we do Lipo 360 in most cases, which is really the abdomen, the flanks, and the entire back, and that fat is transferred to the backside, right? You can add any areas. Many patients want to add the chin or the mons or the inner thighs or the arms. So whereas one person might want the arms done, another one want the legs done, and then the combination, so it doesn't end. So in general, in most cases, the BBL is understood. We're going to do liposuction from those.
Kanisha say I'm a cow.
Easy to do. Not a real issue at all.
Okay. Let's see. This one's from 123 Kaya. What is considered aggressive lipo?
As opposed to lazy lipo?
Yes. Oh my God. Oh, I love this man. Oh, I love this man. I'm supposed to take his word. Lazy lipo. That's what I had my second round. Dr. Cannon, them assistants gave me lazy lipo. But baby, let me tell you, Dr. Triggs gave me aggressive lipo. I love how Dr. Triggs did my lipo 360. Oh, I love how that man did my lipo 360. Dr. Jeff, baby, he did not come to play, baby. He letting y'all know it's a difference. Lazy lipo and aggressive lipo. Okay?
That's how you get the final contour. So we'll do the aggressive liposuction, transfer the fat, and then actually do additional liposuction in many cases after the fat is actually transferred to better define.
Ooh! Ooh! Y'all, if y'all have not had surgery and you going to go have surgery, did y'all just hear what he said? I think that's what happened to me with Dr. Cannon. After they took out enough fat just to put in my butt, they did not go back and thoroughly lipo 360 me. They just took enough fat out to transfer to my ass. But what about my full lipo 360? Did y'all just hear what this man said? He said they supposed to take the fat, put it in your butt, and then go back around and do a 360 so it can be firm on all around so you can have a nice confirmed shape. Oh my God. Oh my.
That we do here to achieve the best possible projection, the best possible contours. I think we're going to show you a patient in a few minutes that will demonstrate that.
Okay.
Oh, wow.
Okay, this one's from Miss Wright, 4016. How soon after having a tummy tuck and back lipo can you turn to intimate relations? So
To have sex?
Okay, so.
Oh, Lord.
All right, it depends. All right, so after a tummy tuck. All right, so we.
Oh, baby, let me tell y'all. After a tummy tuck, you is not going to want to. Baby, I was single 2-3 years ago anyways when I had my tummy tuck. But baby, even if, baby, touch me.
Within the first couple of weeks, we want to protect the belly for 6 to 8 weeks. Certainly, after straight liposuction, we might have more opportunities for whining and dining, etc. But
You say whining and dining.
We really want to be a bit more cautious. Did you mention BBL as well, or just liposuction?
BBL as well.
Similarly, so
And
these
tummy tuck.
and tummy tuck, exactly. So these are areas that we really want to protect, right? We're always protecting the abdominal flap. I talk about this all the time, but we're also protecting the fat that's transferred, right? These cells are trying to find a new home, so we don't want pressure applied to the backside in the first 6 to 8 weeks. So we definitely want to give it, I'd say, probably about 6 weeks.
Oh,
probably the short
wow.
answer for me.
That's a long time. Can you ask for?
Oh, wow.
We might get
I'm
special
sorry.
permission at 4 weeks.
Look how he drew her up.
See how the
Yes.
healing's going and go from there.
Okay, 1, 2, 3. We're gonna get right into this.
Okay, so-
First, let me ask right before 1, 2, 3. Kaya asks, can you?
Why did it go so small?
Do aggressive
Shoot.
lipo when getting a BBL procedure?
100%. So the goal when we're doing especially the isolated BBL procedure, the goal is to remove as much fatty tissue as possible to really accentuate the curves. Right. So that's always our goal.
Yes.
Aggressive liposuction. Right. I was joking before about as opposed to lazy lipo, but we don't do that here.
Yeah, well, baby, we tired of lazy
To
lipo.
accentuate the curves, and also to accentuate the fullness of the buttocks postoperatively.
So what are we looking at here, Dr. Jeff?
So what we're looking at here is a preoperative patient. This was one of our patients from last week who wanted to have aggressive liposuction done and to have a dramatic result in the buttock region.
Oh, she got a lot of.
Preoperatively, I think
Let me tell y'all something. Y'all see her foundation? She has a lot of good sloppy fat. And that's what they call it, sloppy fat, loose fat. Because, baby, her transformation, I need to go back and see that he post her after, if he posted her after. But, baby, she's about to look good. Of course, she going to be swollen after because it look like he's going to get real aggressive with her. Y'all see how he drew her up in her hips and stuff, too? Oh, yeah, she about to be dramatic.
this photo shows her on the operating table.
Wow, she didn't have nothing.
Okay. And can we see her post-operatively?
Oh, my God, I'm ready.
On the table. Right, so here we are, pre-op on the table. So she's laying on her belly, right? This is her buttock region before we
Oh, my
injected
God.
the fatty tissue.
Y'all see that? Do y'all see that? This girl, she has a perfect foundation. I'm ready to see her projection. I'm ready to see.
And Anderson's going to pull up now the immediate result in the operating.
Oh, my God. I was not ready. Oh, my God. This man, she looks good. Baby, if you my cousin and you follow me, baby, you look good, girl. Oh, my God, you looks good. Girl, look at that juicy. Ooh, butterball. Oh, baby. Oh, I'm in ass heaven. Oh, baby. Oh, my God. And you know what? Her butt goes with her thighs. She's not going to look like an ant or a robot, okay? Everything look like it's proportioned correctly, like it's supposed to. Baby, when that swelling go down, baby, they gonna be sick of her. Whew.
I think we're loading. There we go.
Wow.
So that's the patient showing significant
Wow.
projection, contour. And if you look toward the right of the photo at her lower back,
Yep.
that's an area that we're extremely aggressive with because that's what's going to give us the contour improvement.
Ooh.
Right, the lower back superior gluteal region.
Oh, my God. Ooh.
It's amazing, by the way. That projection is just...
Yes, girl.
And the contour.
Yes, girl, that's what I just said. She looks good. That projection, honey.
You can see it
So
there in the
that's
back.
a combination of aggressive and going back and forth as Anderson's doing.
Baby, Dr. Jeff
So
ain't
that's
playing
a
with y'all.
combination Of aggressive liposuction as well as well-placed fatty tissue.
Dr. Jeff ain't come to play with them.
Someone asks, well, she's so cold asks, how long after a breast procedure can I get a BBL? I had 2 boob jobs this year.
Dang.
What you have to, she's trying to ask how long do you have to wait? Maybe
3
until next
procedures.
year?
right? So her most recent procedure was a couple months ago or so. And she's so cold, so we'll see if we can warm her up a little bit. All right. So we can do another procedure, typically 6 to 12 weeks following any prior procedure. Of course, this may vary based on medical conditions, medications, other types of factors involved in the patient's medical history. So we always review that before making these decisions. So I don't want to put a blanket statement out there, but in general, between 6 weeks and 3 months, we're ready to go with most procedures after a prior procedure.
Okay. Miss Cartier asks, do you have to get an extended tummy tuck if you already had a C-section before?
The C-section doesn't change anything.
Yeah.
So that doesn't necessitate.
Why people be thinking that?
When I do the tummy tuck procedure, the incision is placed below the C-section.
Mm-hmm.
So
Yep.
So the C-section
A few
scar,
inches.
Get rid of that completely. All right. So then what you're really asking is, what is the difference between the extended tummy tuck and the regular tummy tuck incision?
Yeah.
And what that's really about is people who have just additional skin laterally, and we're kind of chasing that, because if the incision was just from here to here, we couldn't excise skin that was beyond that. So the extended tummy tuck really pertains specifically to the amount of skin we need to remove. It has nothing to do with the C-section at all.
FMom09 asks, can you get a tummy tuck after you had a hernia replaced with mesh?
Repaired with mesh.
Yeah.
Right? So it depends on the hernia. Is it an umbilical hernia by the belly button? Is it an inguinal
Oh, you can get it repaired together.
More about that. But in general, if the hernia is not recurrent, meaning it has not come back and is not problematic, sure, we take care of patients all the time. And in fact, intraoperatively during the procedure, if I discover that the patient does have a hernia, typically a ventral hernia up and down, or an umbilical hernia by the belly button, I repair those at the same time.
That's what I had.
That's not uncommon. But if somebody's already had one repaired, the repair is intact, and they've healed nicely, we treat them like anyone else. They're more than welcome to proceed with a tummy tuck procedure.
So we have Denise9 Ortez asking, do you do Botox?
I do Botox. I've done it for many years.
What? Y'all, I'm about to... Y'all about to be seeing me doing pre-op down here with Dr. Jeff. Who going with me to Dr. Jeff? I need a surgery, sister. I'm calling Smart tomorrow. I'm calling. I need that Botox for my wedding. I need that Botox. I'm going to Smart. I'm calling Smart tomorrow. Who this man done won me over? This man done won. You know what? I'm about to get off of here because I'm not paying no more deposits. Oh!
Fillers. Primarily, I live in the operating room here at Smart Plastic Surgery,
Yeah.
but I do all of those ancillary services as well.
What?
So we have Moving Nim. She asks, what about just a little perk on the butt with a tummy tuck?
Just a little perk. Okay, not a lot of perk. So you're probably referring to our skinny BBL. And I think we have a couple of videos on
What?
the Instagram page.
Kanisha,
So we do
what?
that commonly. Okay, that's the person who wants just a little extra fullness and a little extra perk, as she put it, which is a great way to put it. All right? There are patients who come in and they simply want to address, hip depressions or hip dips, they're often called. We can do that as well. So, the takeaway message really is that we tailor each procedure to each patient. Everybody's different. Everybody needs something else. Everybody wants something else. So I think, when you're looking for a surgeon, the person you should go with is the one who understands what your expectations are.
Yeah, see, that's what I'm saying.
Go from there so that you're both.
I feel like you need to have a connection with your doctor. If his bedside manners and customer service and all that don't fall in play, and he not making you feel like reassuring you, no, ma'am. That's why I'm glad they have these new laws and regulations where you can meet your doctor, ask as many questions, make sure in person that you're a great candidate or he's going to be the perfect doctor, the perfect fit for you at pre-op, prior to you the next day just seeing him drawing you up for 5 minutes, and then next thing you know, you sleep under anesthesia in the OR room and you wake up and you don't even see the doctor. So I'm glad they passed these new rules and regulations and stuff like that. But yeah, I'm calling Smart tomorrow.
Same page. If you're both on the same page, you're going to have a great result and we'll have a happy patient.
Okay. So we have Platinum Crafts. She's asking, how long should you wait for a second round of BBL?
That's a great question. Okay.
Girl.
So as everyone knows, when we take fat from one part of the body and move it to another, typically at least 30% of that fatty tissue is resorbed, meaning the body absorbs it. So 30% goes away.
Damn.
Okay, because you keep approximately 70%. And we really want to keep all of that 70%. That's why we use the BBL pillow. That's why we have patients not smoke following these procedures, to optimize that. So that 30% is really resorbed by the body, typically over the first 6 months following the procedure.
Oh, and this man's so
the answer to that
detailed.
question would be, I would wait 6 months before doing the second round.
Yep.
Unless it's, an emergency situation, you just need that extra perk, but I don't think that it really is. And it wouldn't really be doing you a service if you do it too soon, because we haven't let things settle out, heal. We're not seeing the final result of the previous procedure.
Yeah.
So for me, I would definitely wait.
Because your fluffer been came 5 or 6
So we
months.
have Anna Mama 1. She said, why do most doctors say you can get a BBL and tummy tuck in one procedure, but your office does?
Many people say you can't.
Yeah.
I have no
Huh?
idea why they would say that, because we do that all the time.
Yeah.
So it's a very standard procedure. So
Very
if you do
standard.
if you were to do the tummy tuck first, you would do all this liposuction and then throw the fat away, and then come back and do the BBL.
That's a combo.
If you do the BBL first, you could harvest the fatty tissue and then come back for the tummy tuck at a later date, which is fine as long as you're not burning a bridge. You can totally do that. But here at Smart Plastic Surgery, we recently did a safety video. We take every variable into account to guarantee our patient's safety. That's our top priority. So with that in mind, we do combination procedures, especially the tummy tuck and the BBL, all the time. As long as patients are cleared, their labs are fine, and there are no other medical issues, there's no reason in the world why you can't do that. Some physicians are more concerned or conservative.
That girl say she want a combo.
They just don't like combining procedures, but we have no problem doing that.
Okay. We have Alda C, 67. She said, when working with the breast, can you also be able to remove a cyst below the armpit?
That's easy. We can do that.
What?
I wanted to add on to the previous question, okay, because it's a very good question about combining.
This man
procedures.
doing-
I don't want anybody to think.
Let me tell y'all something. This man want to do everything that you need done. I don't care how small it is. Any imperfection, he want to get it done all in one, baby. This man is not playing. This man say he'll remove a cyst underneath your arm. He say, yeah, we might as well. That's not a problem. He skipped over that question and went to the whole nother question. Baby, that's easy pleasy to him, baby.
That we'll just add procedure after procedure after procedure. That's not what we're doing. We're not selling used cars here. That's not the objective of Smart Plastic Surgery. The tummy tuck and the BBL, it's a nice combination, okay? But if you also wanted a breast lift and a facelift, and that's great, but we're clearly not going to do that at the same time. So we do stage things very commonly. But the particular, pair of procedures that person
Glory,
has,
girl, he got me
we can
rolling.
use all the time. But once you start adding on to that, a breast reduction, things like that are going to add, several additional hours of operating room time, we're going to say, let's do this in 2 procedures.
Okay. This is a question from Jordan Rose 303. I think a lot of people have this question. I
Yes.
had a 360 lipo BBL 3 weeks ago. How long does it take to see the real result?
3 weeks ago.
The real result, right?
Right.
So it can take, following liposuction, depends on where you started, okay? We have patients who, they start off weighing 140 pounds. We have patients who weigh 230 pounds. So it depends how much liposuction was done. The more liposuction we do, the more swelling we're going to have following surgery.
Yep.
The more compliant the patient is with the garments and the fajas and the compression garments that we use,
We want
the more
aggressive.
rapidly the swelling is going to improve. So the short answer is we're going to get to that final result when the majority of the swelling has resolved.
Girl, I like that dress.
Up to 3 to 6 months, but ideally you're going to see your results like you just saw the one on the table, like even before they leave our facility. So you'll see the result, and then a lot of swelling sets in following that. With the patient we showed you and talked about, there's no real swelling at that point in time. So you see the result, but there's going to be swelling that occurs and that resolves. Just be patient and let that resolve.
Right, because when we get surgery, we want to
Want it yesterday.
Yes.
Yes.
We want to see the
surgery yesterday and
result.
the result the day before.
Yes, girl.
Exactly. And then you get all concerned, and then you look weird sometimes, and it takes time. Swelling goes up and down.
Mm-hmm.
I have these conversations fairly often, and we could also have patients who have asymmetric swelling. which means that we might have
What's
more
that?
swelling on one side than the other.
Oh, yeah.
You know, it may be affected by how they're sitting, how they're sleeping,
Yep.
other things that they're doing. So that's nothing to be concerned about. And a lot of these are all great questions. We answer these fairly commonly. I'm happy to keep answering these because it's wonderful. We have new people joining us all the time, which is great.
Yeah.
Just one small tip: feel free to go to our previous live sessions. They're all on the
Research. He basically trying to tell y'all to educate yourself.
to look at other previous questions if you're curious, and these might answer.
See, he basically telling y'all to educate yourself. That's why I like that he's very detailed. He's very informative. He seemed like he's very patient and very transparent. And he's very, it seemed like he said, what really touched me, what he said, was when he said we not selling used cars. When he said that, that made me feel like y'all are I'm not gonna say y'all, I'm gonna say we, because I didn't had a whole bunch of rounds. Okay, I'm part of the journey. He said we are not selling used cars. So basically that makes me feel that he's saying basically that we are not just a number. We're not just, you know what I'm saying, a chop shop. Like he's not just, in and out next, in and out next, next. Like he's really, this is what he do. It seems like he's really, really passionate. Like really passionate. Not only that, this man, I feel like he's not going to get bored because he's doing other stuff. Like he's doing combos, he's doing injections, he's doing facial reconstructions, he's doing fillers and dermas and chin lipos and all that. Like, I love it here.
Questions or leave you with more questions, and that's good too.
Okay. So we have two key jail. She says, what is the downtime for Lipo 360?
That's a great question.
He surely is, Kanisha.
You're going to be in a compression garment for at least 6 to 8 weeks afterwards. The downtime, it varies also, like all these things do. But typically, I'd say about 5 days. It varies, could be 5 to 7 days. Some patients go back to work a few days later. So it is variable, but it's not an extended recovery period at all. It's a very straightforward recovery period.
Okay. I love me 92. Ask again. With BBL, with BBL, do you lipo the back? Also, do you use ultrasound when injecting
Glorious.
the back?
So those are great questions. I love me, right?
Gloria, let's go.
Right, that's what this is all about. So ultimately, you could be I love me more, right? That would be ideal. But yeah, I touched upon this a few minutes ago, that liposuction of the back is critical, all right? And the case that we showed, the photos that we put on the screen, there was a lot of liposuction done to the lower back and the upper back as well. Mm-hmm. And the 360 procedure includes the front and the back, but any BBL procedure, some patients don't want any liposuction on the front, and that's okay. But all of them are going to have liposuction of the lower back and that region to accentuate the result. And with ultrasound, we've done that. The regulations vary. We're always in compliance with the state regulations, so we always do that when it's necessary and appropriate.
Okay. I think this question should be addressed. Talk spay. Tummy tuck with 2 areas and full back lipo. Is that the same as lipo 360?
It can be. 2 areas on the
Tummy
back.
tuck.
Yeah, I'd say that.
Yeah.
Typically, when I do a tummy tuck procedure, those 2 areas are usually the flanks, but I usually do the upper abdomen as well. I'm conservative there. I've been doing that for 23 years. I think that's how you avoid any fullness here. Because if you don't do that, you may have somebody come back and say, oh, this looks great, but I'm a little full here. Why is that? That's because no liposuction was done. You can have a great result and not have any residual fullness down the road.
That makes
as
sense.
As far as the back goes, if you're going to do the full back, that really would constitute a 360 procedure.
123 Kaya's asking, after 10 massages, can you massage yourself? I don't think that's a good idea.
After 10?
It depends on the areas. Okay, so 10 massages following straight liposuction, I don't have a problem where their spouse can, or they could be trained to do that. If the tummy tuck, we want nobody going next to that abdominal flap. I say it all the time, for at least 6 to 8 weeks. But the back, other areas of the body can absolutely be massaged.
Especially,
There's no.
let me tell y'all something. Once y'all get 8 weeks, Baby, get that roller and put it on that back. The first couple of times it's gonna be tense, but baby, guess what, baby? You ain't gonna have no rolls back there. It's just like trying to make some homemade bread, baby, and you using that roller and you flattening out that dough. You flatten out that dough, you put that flour on there and you flatten out that dough, baby. That's how that back gonna be. Cause guess what? We want that back flat as a tortilla, honey. He didn't come here to play, okay? We rolling out the back fat, okay? We rolling out the back fat, okay?
Too much. And if the person who wants to do it herself is trained by...
Girl, look, I'm going with Dr. Jeff too.
The therapists to do that, I don't have a problem with that at all. Or if they train the spouse or the significant other, I don't have a problem with that either. But we definitely need for people to know what they're doing because they can do harm if they're not trained to do this.
Of course. So you have to be safe. Okay.
This was a good interview.
Let's see, anything important here that we should address.
She asked some good questions. Oh my
Please,
God.
guys, if you have any more questions, this is your last chance to send them in.
And also, please feel free to send photos in.
Yes.
We'll do both live evaluations as well as...
Oh, see, I like him. I like him. I like him.
As far as how I approach all different types of cases, whether it's the face, the breast, the body. So if you send us photos, we can kind of evaluate these and give our thoughts, subsequent in a separate session or follow-up session.
Yes,
Oh,
so
see, yeah.
If you have any concerns with facial features or anything like that, don't be afraid to send them in the DMs. Dr. Jeff will look over them and send you his opinions. And if you want a consultation, we'll see you too.
Yeah, I'm coming.
This is not a question, but she says, "I think I like this guy." Jeff's gonna keep watching him.
I appreciate it. Keep those coming. So we really appreciate it. And another great session. We're always excited to do these. Always enjoy answering any of your questions. So keep them coming. Send the photos in. We're going to kind of, add an additional format where we really address evaluations and all of that. So we have a real, kind of dialogue with our patients out there.
Okay, we'll do 3 more questions, guys, because I see a lot of questions coming in.
Girl, yes.
And we're gonna wrap it up, okay, guys? Jordan Ross 303 says, after my surgery, I've been really weak and I get tired frequently. Is that a normal thing?
It is normal. She didn't tell us what type of surgery, but assuming it's either a major liposuction or BBL or tummy tuck or any procedure, it could be a facelift, where you've been in the OR for several hours. That's very common. That could be even an early or a late post-op anesthesia, effect, which usually resolves. She says her surgery was how long ago?
I believe it's about 3 weeks ago.
Yep, so that's not unusual at all. We can even see these effects even up to 6 weeks. So don't worry about that. Most important thing you can do is stay hydrated. Okay, because if your pressure drops a little bit because you're dehydrated, that's going to affect how you feel overall. So I would stay hydrated, and at 3 weeks you should be moving around and doing a bunch of things regardless of the procedure you've had. If you have any questions as to what you can do, feel free to contact us directly. I'd be happy to respond. But what you've described is not unusual at all.
Okay, so we have Jamie 366. She said, what is considered too high of a blood pressure for surgery, even with a clearance from my doctor?
They not going to... Let me tell you something. At the day of surgery, you're not going to be able to have surgery if your blood pressure is high because they doing your blood pressure at pre-op and before the anesthesia guy come in there. So if your blood pressure is high, they going to tell you to take some deep breaths, go drink some water, calm down, relax, breathe, exhale. And then if that does not work, they're going to try to take your blood pressure one more time because that's what they did to my aunt when we went our first round and she could not get her surgery done because her blood pressure was extremely high. Y'all have to be calm. We know you excited, but you don't want to get too overwhelmed where you're flaring up and your anxiety is through the roof and your blood pressure is through the sky. They're gonna counsel you. They're gonna try to counsel you and try to maybe push you to the next day. But yeah, your blood pressure has to be elevated.
That's a great question. All right. So you have your systolic over your diastolic number, right? So the 120 over 80 is a typical average pressure. When you get to 95 on the bottom number, we consider that to be borderline hypertension. So, we don't want to go beyond that, but we do see patients, we do operate on patients who are even, 98, 100, even 102. Our anesthesia team will evaluate and clear them, and that's not necessarily a problem. But when patients come in and they're, 180 over 120 or 116, that's a problem. So we're not going to proceed with the surgery. We're going to step back, regroup, speak to the primary care physician, make sure that the patient's taking the appropriate medications or needs different medications. So we're very serious about hypertension because we don't want to have a bleed following surgery. So we always want to be very serious.
Oh, I love he take all the
Okay,
precautions.
last question. This one's from Bonnie Bell Glam. The IV drips are very popular. Thoughts? I was actually looking at a TikTok this morning about getting IV drips before
And after surgery.
So yes, what are your thoughts on that?
It's all about staying hydrated. So
Yeah.
I want to know specifically, if it's one, like what.
Let me tell y'all something. Yes, the hydration, like he just said, the IV is very good for people that I guess they don't drink a lot of water. But me personally, mentally, knowing that I'm going to have surgery, you want to make sure you drinking as many liters as possible because basically that's all they doing with the hydration. You getting fluid put back in you. Yeah, they can add a few vitamins, they can add B12 and stuff like that, but you should have been like staying hydrated. You want to make sure that you are hydrated. I don't care if you don't like water. Water better become your best friend, cousin, because you about to have surgery and you don't need no issues after surgery with being dehydrated, falling out, feeling lightheaded, gotta go to the emergency room. Make sure that y'all crossing all y'all T's and dotting all y'all I's.
Components are in that particular drip. But if it's saline or electrolytes, I have no problem with that at all. And again, it's all about staying hydrated. But I don't want people running out and getting some crazy drips that I don't know what they're receiving. But in general, if it's about hydration and electrolyte replacement,
Right.
I'm totally fine with that.
All right, amazing. So we're gonna wrap this up. Guys, don't forget to send in your questions early on in the live. Don't wait until the last minute when we can't read all of your questions. We really,
Photos too.
yes, and send.
He
photos.
want them
We really wanna
photos,
address
baby.
most of, or if we can, all of your questions. And yeah, we're happy to have you today, me and Dr. Jeff. And we'll see you next time on the live.
Bye. Ah! Y'all, I don't know what y'all think. Like, I really like him. Oh my God. Oh my God. When I tell you, I feel like he was so informative. He was very detailed. It seemed like he have an open door policy. It seemed like his bedside manners is very well. Also, I love so far his personality. He seems like he's very open to answer questions, even though he already said it's a lot of people that he get that ask the same questions over and over and over. He doesn't mind answering them, but he wants you to also go back and look at the other videos where he's already answered those, so that way you can already be reassured and you'll be on the next thing coming. You'll be ready for the next question. You don't have to keep asking the same stuff that he already covered, and you'll already be better mentally prepared. Also, what I like about him is that he's diverse. He does different things over there at Smart, and I'm sure where he come from. He say he has a background of over 23 years of reconstruction. After a while, they're gonna be calling him the Combo King as well. We call Dr. Shanklin the Combo King because, of course, we known him to be over there at Vixen doing multiple different types of procedure at one time, but the show don't stop. It's always somebody else out there that's doing just the same thing. We just have to find out about them. And Dr. Shanklin brought Dr. Jeff on board because he's a good doctor, and he's over there with Dr. Shanklin, and he's going to bring people over there. I'm already hearing a lot of people from Vixen is coming over there to Smart. We have a lot of new cousins coming over there to Smart. So they are getting the business. They really are getting the business. I believe Dr. Shanklin never has stopped using the machine. Even he the one who really introduced it over there to Vixen. So I don't know if Vixen had ever stopped using it or if they was originally using it, but Dr. Shanklin made it known that he was definitely using that machine. And so I'm quite sure Dr. Jeff is using it too over there at Smart. Other than that, this was a good live. I love the fact that he was very informative and he was very descriptive when he was answering all the questions. He wasn't rushing through any of the questions, and he was really elaborating on that he does not do lazy lipo. That's the main thing. We do not want lazy lipo when we getting our lipo 360 or getting our BBLs and all that good stuff. We do not want no lazy lipo. I love the fact that he's very aggressive with lipo. I love to see the bruising. The bruising does not last on you, cousin. The bruising goes away. But let me tell you something. You don't see no bruising, that mean they wasn't that aggressive. I want to see some bruising. I want to be aching coming out of surgery, okay? I want to be aching. The ache do not last forever, but at least you know that they touched you, okay? Other than that, like, I'm going to call over there tomorrow because I need to get some pricing on a few things. I need to get some pricing on a few things over there at Smart tomorrow, Dr. Jeff. So I need to talk to Nancy. I need to talk to Nancy. It have been brought to my attention over there at Smart. They are not doing no VIP over there. So y'all disregard all them rumors and them groups. Like I told y'all, it's getting close to the surgery. It's crunch time. Get out of the negative groups. Anybody that's trying to persuade you or coming saying negative stuff and this and that. Now, don't get me wrong. Everybody's experience is different. It doesn't mean that they're being negative because they had a bad experience. They got an infection. It's okay for that person to explain how they feel or express themselves. You know, everybody not going to have the same experience, so we have to be respectful to the ones that are going through it, be respectful to the ones that had the great experience as well. Anybody that's getting ready to have surgery, I wish you a wonderful recovery, safe travel going and coming, and remember, you came this far. Continue pushing through this journey. Keep positive people around you. And oh my God, I pray that y'all love y'all results regardless of who the doctor is that y'all chose. I love the fact that they are starting this new rules and regulations and they're using the machine. The doctor is being present. They can't do a certain amount of BBLs in a certain point of day. You're not going to feel like a used car or just like a number. They are really taking their time when you are there and they're answering questions and you are seeing your actual doctor at pre-op. That would make me feel so warm inside to actually see the doctor ahead of time, get kind of a feel of them, you know, versus seeing them on social media and stuff like that. That makes you feel a little bit more comfortable knowing that this is the person that's getting ready to perform your surgery. So I wish everybody well. Dr. Jeff did a very good live. I can't wait for his next live. And until next time, thank you for watching. Don't forget to subscribe if you are new here. Don't forget to thumbs up this video. And I'm out.